India has seen a staggering increase in the number of stroke cases in the last 3 decades, according to a new study published in the journal Lancet Neurology. The country recorded over 1.25 million new stroke cases in 2021 compared to 650,000 in 1990, an increase of 51%. The prevalence of stroke has surged from 4.4 million to 9.4 million during this period. India now accounts for 10% of the global burden of stroke. Globally, the number of people affected by strokes rose to 11.9 million in 2021, marking a 70% increase since 1990. With 1.25 million new stroke cases, India made up 10% of the global burden in 2021. More than 75% of stroke victims are found in low and middle income countries, highlighting a significant health disparity. The study points to environmental risk factors, particularly air pollution, as a major contributor to this crisis in these regions, where pollution accounts for a greater proportion of stroke burden than in wealthier nations. Catherine O. Johnson, lead research scientist at the Institute for Health Metrics and Evaluation, emphasized the urgent need for climate action, stating, "Given that ambient air pollution is reciprocally linked with ambient temperature and climate change, the importance of urgent climate actions and measures to reduce air pollution cannot be overestimated." The researchers identified rising stroke rates as being influenced by a combination of factors, including population growth, aging demographics, and increasing exposure to both environmental and behavioral risks. The research team analyzed data from 204 countries between 1990 and 2021, revealing that while stroke-related deaths have decreased by 44%, disability-adjusted life years due to strokes have risen by 32%. Key risk factors such as air pollution, tobacco use, and metabolic issues have been pinpointed. Valerie F., Director of the National Institute for Stroke and Applied Neurosciences at Auckland University of Technology in New Zealand and a co-author of the study, stated, "The global growth of number of people who develop stroke and die from or remain disabled by stroke is growing fast, strongly suggesting that currently used prevention strategies are not sufficiently effective." The study also highlights the significant role of particulate matter from air pollution, linking it to subarachnoid hemorrhage and placing it on par with smoking in terms of risk. Researchers advocate for community engagement to address these modifiable risk factors, stating, "Identifying sustainable ways to work with communities to take action to prevent and control modifiable risk factors for stroke is essential to address this growing crisis."